welcome back to my channel. Today is part 2 of my little Masters in Public Health series, and I'll be talking about what public health is. So let's get started. So what is public health? The art and science of preventing disease. Doctors are in the business of diagnosing, pharmacists and pharmaceutical professionals are in the business of treating, but public health professionals, we are in the business of prevention. There are 4 essentials of public health, and I'm gonna read them off because I cannot remember off the top of my head, but I know it's like assessment, policy. Anyway, the core essentials of public health are assessment, policy, oh look at that, I got those too, development, and assurance. So public health professionals will assess an issue. Well, for example, seatbelts. Yes, seatbelts is a public health initiative. Back in the day when they didn't have to wear seatbelts, when people would get in car accidents, people would die more quickly because they would shoot out of the car, whatever the case is. In assessing that situation, public health professionals thought, what if there was something to restrain people from flying out of the car? That's how the seatbelt came about, where it's at the bottom and the top. So when the car goes forward and slams on the brake, the seatbelt stops you, which can prevent death. So the assessment happened. Okay, we need something to protect people when they're in these cars. The policy that came as a result of that assessment is it's against the law not to wear your seatbelt. The development process is, of course, working with car manufacturers and whomever else to ensure that all cars are equipped with seatbelts. The assurance is police officers enforcing the law and making sure that people are wearing their seatbelts, giving people tickets who don't wear seatbelts, and so on and so forth. So that's how most public health initiatives work. Like kids being inside for too long, that's how the whole Nickelodeon Get Up and Go Play Michelle Obama initiative really took place, because they assessed the rise of childhood obesity in America. A lot of people ask, what are the different jobs, that I'm looking at my phone just so I can read off the different jobs for you guys. I've said this in so many different videos, and I will say it again. You can do anything with your master's in public health. You can go and work for Netflix if you want to. If they're looking for someone who has experience in public health, there are so many movies and documentaries that talk about different health issues like smoking, those food movies, all these crazy movies that talk about eating meat and stuff. They talk to public health professionals about the repercussions those types of things have on the American society. That's just one thing you could do. You do pharmaceuticals, you can run a hospital, you can go and do policy, you can be a community worker, you can go work at a nursing home. You can do anything. Public health professionals have a very great niche where, like I said in the beginning of this video, you're in the business of prevention. So hospitals, of course, want to prevent maternal complications. Someone who has their master's of public health could assess the issues that the hospital has, could see these doctors are working too much so they're not able to see this or see that. You could do anything. But the most common jobs are as follows. There's a public health generalist, which I assume you just do general public health thing, probably community worker. The salary for that ranges from $44,000 to $85,000 a year. Then there's, of course, the epidemiologist, which you could go work for the CDC. You could work for a pharmaceutical company. I think you could also work for a hospital because they probably look at their own epidemiological stats. But epidemiologists make anywhere from $70,000 to $114,000 a year. Moving on to biostatisticians, if you're not good at math, this job probably isn't for you. Biostatisticians make anywhere from $80,000 a year to $130,000. It could be higher than that because pharmaceutical companies, they love a good statistician. The next one on the list is an environmental scientist, and they make anywhere from $68,000 to $120,000. And we have social and behavioral health professionals who make anywhere from $79,000 to $95,000 a year. We have emergency and disaster preparedness. Wear a mask, okay? I had to just insert that in there. Definitely having your master's in public health could get you a job in emergency and disaster preparedness. I'm sure there are people who were at the White House at the time during the Obama administration who helped him prepare that pandemic plan. There were definitely public health professionals and medical doctors involved in drafting that bill. And emergency and disaster preparedness professionals make anywhere from $70,000 to $133,000. And I feel like if you work in the White House, you probably get paid more. Lastly, you could be a consultant, which ranges anywhere from $100,000 to 7 figures. And I say 7 figures because you could own your own consultant firm, which is a beautiful idea. Do you know how many people are going to be thinking about the next pandemic or epidemic that could happen? We've never been shaken up like this before. This has got the world shooken up. So if you want to get your master's in public health and want to become a consultant and create your own niche, that's definitely something you could do. So that's just a little bit about what public health is, the different type of jobs you could get. I'm gonna try and come up with more series on public health topics. If you have any ideas, put some comments down below. I love answering all your guys' questions. Let me know. Don't forget to visit careersavage.com if you ever need a little bit more guidance. I offer consultations, 15 minutes, 30 minutes, and 60 minutes. Thanks so much for watching, guys. And if you're not subscribed already, what are you doing? Subscribe. Bye, guys.